Have you ever wondered how diabetes can affect your eyesight? Imagine a world where your vision slowly fades away, where the beauty of colors and the faces of your loved ones become distant memories. Today, we're going to dive into a compelling journey, exploring the hidden dangers of a complication known as diabetic retinopathy. Join us as we uncover the secrets behind this silent threat, unravel its stages, decipher its symptoms, and unveil the key to prevention and treatment. So, grab a seat, open your eyes wide, and let's embark on this eye-opening adventure together. What is diabetic retinopathy? In the vast universe of diabetes, there exists a hidden menace that silently attacks the windows to our souls, the retina. Diabetic retinopathy, as it is known, emerges from the ashes of persistently high blood sugar levels, stealthily damaging the delicate blood vessels that nourish this vital eye component. The retina, responsible for capturing light and transforming it into images, becomes a battlefield where diabetes wages its war. But fear not, for knowledge and action are our greatest weapons. By controlling our blood sugar, blood pressure, and cholesterol levels, we can fortify our defenses. Moreover, the annual pilgrimage to our optician for diabetic eye screenings becomes our sacred ritual for early detection and intervention. Who is at risk? Diabetic retinopathy is a common complication of diabetes that affects the eyes. It occurs when high levels of blood sugar damage the blood vessels in the retina, leading to vision problems and potential blindness if left untreated. While anyone with type 1 or type 2 diabetes is at risk of developing diabetic retinopathy, certain factors can increase the likelihood of its occurrence. Number 1. Duration of diabetes. The risk of developing diabetic retinopathy increases with the duration of diabetes. Studies have shown that the longer a person has diabetes, the greater their risk of developing this condition. The American Diabetes Association states that nearly all individuals with type 1 diabetes will develop some form of diabetic retinopathy within 20 years of diagnosis, and approximately 60% of people with type 2 diabetes will develop the condition within 10 years of diagnosis. Number 2. Poor blood sugar control. Persistently high blood sugar levels over time can significantly increase the risk of diabetic retinopathy. When blood sugar levels are elevated, it can cause damage to the blood vessels in the retina. The Diabetes Control and Complications Trial, DCCT, and the United Kingdom Prospective Diabetes Study, UKPDS, demonstrated that individuals with better blood sugar control had a significantly lower risk of developing diabetic retinopathy. Number 3. High blood pressure. Hypertension, or high blood pressure, can further contribute to the development and progression of diabetic retinopathy. High blood pressure can damage the blood vessels in the retina and increase the risk of complications. A study published in the journal Diabetes Care found that individuals with both diabetes and high blood pressure had a higher prevalence of diabetic retinopathy compared to those with diabetes alone. Number 4. High cholesterol levels. Elevated levels of cholesterol, particularly LDL, low-density lipoprotein, cholesterol or bad cholesterol, can also increase the risk of diabetic retinopathy. High cholesterol can contribute to the narrowing and hardening of blood vessels, including those in the retina. The American Journal of Ophthalmology published a study that found a significant association between elevated LDL cholesterol levels and the presence and severity of diabetic retinopathy. Number 5. Pregnancy. Pregnant women with diabetes, particularly those with pre-existing diabetes or gestational diabetes, are at an increased risk of developing diabetic retinopathy. Pregnancy can exacerbate existing diabetic retinopathy or increase the likelihood of its development. The American Academy of Ophthalmology recommends that pregnant women with diabetes undergo a comprehensive eye examination in the first trimester and close follow-up throughout pregnancy to monitor for the progression of diabetic retinopathy. Number 6. Ethnic background. Certain ethnic groups, such as individuals of Asian or Afro-Caribbean descent, may have a higher predisposition to developing diabetic retinopathy. A population-based study conducted in the United Kingdom found that individuals of South Asian and Afro-Caribbean origin had a higher prevalence of diabetic retinopathy compared to those of European origin. It's important to note that these factors increase the risk of developing diabetic retinopathy but do not guarantee its occurrence. Proper management of diabetes, including regular monitoring of blood sugar levels, blood pressure control, cholesterol management, and regular eye examinations, can help reduce the risk and prevent or manage the progression of diabetic retinopathy. If you have diabetes and fall into any of these categories, it is crucial to work closely with your healthcare team to ensure optimal diabetes and eye health management. Symptoms and the importance of screening. In the early stages, diabetic retinopathy often doesn't have obvious symptoms. However, signs can be detected through regular eye screenings, which include photographs of the back of the eye. It's essential to contact your optician immediately if you experience gradually worsening vision, sudden vision loss, floaters, shapes floating in your vision, blurred or patchy vision, eye pain, or redness. Diabetic eye screening plays a vital role in early detection since the condition doesn't typically cause noticeable symptoms until it's more advanced. Screening can detect problems before they affect your vision, allowing for prompt treatment. Understanding the stages. Diabetic retinopathy develops in stages over time. Stage number 1, known as background retinopathy, involves the appearance of tiny bulges called microneurae SMS in the blood vessels of the retina. At this stage, your vision is usually unaffected, but there's a higher risk of future vision problems. Stage number 2. Pre-proliferative retinopathy indicates more severe changes in the retina, including bleeding. Regular screening appointments are necessary to monitor your eyes. Stage number 3. Proliferative retinopathy is the advanced stage where new blood vessels and scar tissue form on the retina, leading to significant bleeding and possible retinal detachment. Vision loss is highly probable at this stage. Diabetic maculopathy and reducing your risk. Diabetic maculopathy is when the blood vessels in the macula, the central part of the retina, become leaky or blocked. Specialized testing and treatment may be required to prevent further vision deterioration. To reduce the risk of diabetic retinopathy, it's crucial to control blood sugar, blood pressure, and cholesterol levels. Attend all screening appointments, seek medical advice promptly if you notice vision changes, and maintain a healthy weight through a balanced diet and regular exercise. Quitting smoking is also highly beneficial. Treatment options. Treatment for diabetic retinopathy becomes necessary when it reaches an advanced stage and poses a risk to your vision. The primary focus of treatment is to stabilize and manage the condition. For advanced stages, there are 3 main treatment options. Laser treatment. Laser treatment is commonly used to address new blood vessels in the advanced stages of diabetic retinopathy. This procedure aims to stabilize the weakened blood vessels and prevent further bleeding into the eye. While laser treatment can help preserve existing vision, it typically does not improve vision that has already been lost. Eye injections. In some cases, diabetic maculopathy may require injections of a medication called anti-VEGF directly into the eye. This treatment aims to prevent the formation of new blood vessels at the back of the eye. Regular injections can help slow down the progression of the condition and protect your vision. Eye surgery. Eye surgery may be recommended for severe cases of diabetic retinopathy, especially when there is a risk of retinal detachment. The procedure involves removing a portion of the vitreous humor, the gel-like substance that fills the space behind the lens of the eye. Surgery can help stabilize the retina and prevent further vision loss. It's important to note that treatment options may vary depending on the individual case, and the final decision will be made by a specialist, such as an ophthalmologist. These treatments aim to preserve your remaining vision and prevent further deterioration. A story of hope and inspiration. Now that we've covered the essential information about diabetic retinopathy, let me share with you a story of hope and inspiration. Meet Sarah, a 45-year-old woman who was diagnosed with type 2 diabetes a decade ago. Like many others, Sarah was unaware of the potential complications that diabetes could have on her eyesight. As the years went by, Sarah diligently managed her blood sugar levels, exercised regularly, and attended her annual diabetic eye screenings. She understood the importance of taking proactive measures to protect her vision. However, despite her efforts, Sarah started experiencing some changes in her vision during one of her screenings. Fear and worry consumed Sarah as she awaited her appointment with an ophthalmologist. She couldn't imagine a life without a clear vision. But instead of letting despair take over, Sarah decided to stay positive and informed. She educated herself about diabetic retinopathy and the available treatment options. During her appointment, the ophthalmologist explained that Sarah had reached the pre-proliferative retinopathy stage. Although her vision was not severely affected at that point, the doctor recommended laser treatment to prevent further progression of the condition. Sarah agreed, understanding that early intervention was crucial. Over the following months, Sarah underwent a series of laser treatments. It was not an easy journey, as she experienced some discomfort and temporary blurriness after each procedure. However, Sarah remained steadfast in her determination to protect her vision and continued to follow the doctor's recommendations. Today, Sarah's story is one of triumph. With regular screenings, effective management of her diabetes, and timely treatment, she has successfully preserved her vision. Sarah's experience serves as a reminder that diabetic retinopathy doesn't have to be a sentence of vision loss. With the right knowledge, proactive measures, and support from healthcare professionals, it's possible to overcome the challenges posed by this condition. Diabetic retinopathy is a serious complication of diabetes that can lead to vision loss if left untreated. By understanding the stages, symptoms, and risk factors associated with this condition, you can take proactive steps to protect your eye health. Regular screening appointments, controlling your blood sugar levels, support from healthcare professionals, and adopting a healthy lifestyle can significantly reduce the risk of diabetic retinopathy. If you notice any changes in your vision or experience symptoms related to diabetic retinopathy, seek immediate medical attention. With that said, we hope this video has shed light on diabetic retinopathy, its stages, symptoms, prevention strategies, and treatment options. Stay informed, stay proactive, and take care of your eyes. Thanks for watching, and make sure to subscribe to our channel for more informative content. Until next time.